Good morning, everyone. My name is Professor Roger O'Sullivan, and on behalf of the Institute of Public Health, I'm delighted to welcome you to this webinar today entitled Getting Older, Staying Active, Promoting Physical Activity to Older Adults. This is about lessons from the Generating Active Lives in Older People, known as the Gallup Research Project. Today's event is part of a program of research, publications, and events on physical activity and older people. There's a wealth of evidence showing the benefits of physical activity and the consequences of physical inactivity. The message is clear and simple. We need to move more. Research tells us that physically active older adults experience healthier aging, a better quality of life, and are a lower risk of developing illness than those who are physically inactive. However, physical activity levels remain low among older adults in Ireland and Northern Ireland, and these typically decrease with age, but this doesn't need to be the case. Healthcare professionals have a key role in promoting physical activity, particularly among populations at greatest risk of poor health due to physical inactivity. We have an opportunity to improve the health and well-being of older adults by increasingly focusing on prevention as well as treatment. Today is about learning and understanding how we can all be part of a culture of change around physical activity, be this at home, in the community, or at work. Today, you will hear the results of a three-year program of research by the Institute of Public Health. This involved a systematic review of the evidence in physical activity, a review of the physical activity and aging policy and frameworks in Ireland and Northern Ireland, a survey of healthcare professionals in Ireland and Northern Ireland, and over 60 interviews with healthcare professionals in Ireland. For those who want to read more about the work, it has been published in the International Journal of Environmental Research and Public Health, and IPH have also produced a two-page summary of this work. We're delighted that this event and our research have attracted so much interest. 450 people registered for our webinar today, highlighting the importance of this area of work, especially as we move through a new phase of living with the COVID pandemic, and opportunities for physical activity are increasing. The format of today is that we will have the ministerial welcome, followed by a presentation from Dr. Conor Cunningham, the researcher on the Gallup Project, and then a panel discussion with representatives from the four occupations studied in the research. Can I ask you to please submit your questions for the panel in the Q&A function within Zoom at the bottom of your screen, and my colleague Aideen will group and pass them back to me, and then we'll ask the panel. I hope you'll find this webinar enjoyable, informative, and indeed active. Paul Galler from Age and Opportunity will occasionally be getting us moving throughout this morning's session. Please feel free to tweet about this event using the hashtag #GettingOlderStayingActive. Throughout this webinar, we will also conduct a number of different polls. And so our first poll is going to be on the screen right now. So this is a chance for you to vote. So just a general question. How many minutes of moderate intensity physical activity are older adults recommended to engage in on a weekly basis? You have a number of options, so please pick an option. Okay, you have 60, 90, 120, 150, or don't know. Adam, do you want to share the results? Okay, so we have 4% at 60, 14% at 90, 26% at 120, and half of those who answered indicated 150 plus minutes, and that's the correct answer. So well done, everybody. Before we go forward, we'll just do one more poll question. So Adam, do you want to put on the poll question, please? So here's a question. Could you explain the difference between moderate and vigorous physical activity? Yes, no, don't know. Okay, Adam. So, very positive. Nearly 100 people, 85% who answered this poll indicated they could. Just under 10% said no, and another 6% said don't know. Okay, so thank you very much. We're going to have a few of those polls throughout this morning, and thanks again. So please feel free to submit your questions for the panel. Also feel free to tweet throughout the morning. Okay, so I am delighted now to welcome Minister Frank Feehan, Minister of State at the Department of Health with responsibility for mental health and older people, to give a welcome to this webinar.
I am delighted to have been asked by the Institute of Public Health to open this webinar on getting older, staying active, promoting physical activity to older adults. The Institute is a vital partner in the development of health policy in Ireland, particularly in light of its role as an all-island body, and I would like to take this opportunity to thank you all for your hard work. Today we are launching the findings of new research carried out by the Institute as part of the Generating Active Lives in Older People project. One of the cornerstones of the Healthy Ireland framework is inclusion, and long before the arrival of COVID-19, we knew that some groups in our society needed targeted interventions to ensure that their particular needs are met, and older adults are one such group. This principle has taken on a new urgency since the onset of the pandemic. While COVID-19 has challenged and disrupted the lives of every one of our citizens, we have had to make special provisions for those who are most vulnerable. Since the onset of the pandemic in March of last year, my department has ensured that older adults have been a particular focus of our Healthy Ireland national communications campaign, most recently with the Keep Well campaign, which ended in June of this year. At all stages of our campaigns, we have provided resources to ensure that older and more vulnerable adults can continue to look after their health and well-being, both physical and mental. We are now moving into a new phase of living with COVID-19, and while we are in a much better space now than we were this time last year, we will need to remain vigilant in our work to address both the specific challenges of COVID-19 and the broader challenge of promoting healthier lifestyles, particularly for more of our vulnerable citizens. The promotion of physical activity is a key priority of this work, and my department's policy for promoting physical activity, the National Physical Activity Plan, has a wide scope, including action areas that address public communications, children and young people, health, the environment, workplaces, community, sport, and physical activity and research, monitoring and evaluation. All of these action areas have been implemented through partnership, and significant progress has been made. The research being launched today contains much positive news, but also some cause for concern, and it is encouraging that 42.7% of respondents are aware of the national guidelines on physical activity, and that 70.3% agreed that discussing physical activity is their job. However, the research also shows clearly that many healthcare professionals need more training and support to initiate conversations with patients about physical activity. I note that only 12.1% of respondents said that they always signposted patients to other physical activity services. There is clearly scope for progress in this area. Earlier this year, I was pleased to take part in the launch of the HSE's new framework for social prescribing. You will all be aware of the benefits and the potential of this exciting and growing area of healthcare. Social prescribing provides us with a great opportunity to promote physical activity amongst all population groups, and in particular older adults. However, it is obvious from the findings of this research that healthcare professionals feel they need more training and resources in order to develop their knowledge and practice in this area. And this is something we will have to examine going forward. We will be reviewing the future of the National Physical Activity Plan in the coming months. The outcome of this review will determine our future policy on physical activity, and I have no doubts that today's research along with other research findings, will provide very valuable insights for future actions in this area. It only remains now for me to thank the Institute of Public Health for completing this valuable research and for their wider work supporting health and well-being across the island of Ireland. Thank you.
So again, thank you to the Minister for that opening address. We're now going to move to a little bit of physical activity. Part of the issue is we're talking about physical activity, so it's important to try some physical activity as well. So Paul, thank you very much for joining us. Do you want to talk us through?
Yeah, thanks a million, Roger, and thanks to you and all your colleagues at the Institute of Public Health for having me on today. And as you said, for having the foresight of having actual physical activity included in this morning's webinar, which is all about physical activity. So what I'm going to do, folks, you can either do this seated or you can do it standing. Now, if you're like me, maybe, and you've been at the desk all morning, it might be a nice opportunity just to get up and get standing. But the little movements that I'm going to do with you now, they're all going to be, they can be done either seated or from a standing position as well. So as Roger said, we have two slots. The first one now we're going to mobilize, and then after a while we're going to come back and we're going to energize, okay? So whether you're seated or standing, I'll ask you just to keep a nice tall posture. So ideally you're going to have your hips and your shoulders just in a nice straight line, okay? So our first movement now is not the most attractive one, and if you find yourself that you look good when you're doing it, you're actually not doing it right. So the worse that you look, the better it is for your overall health. So we're just going to stand up, and we call this chins and pigeons. So we're just, you imagine a pigeon, we're just going to stick our chin out, and we're just going to mobilize the neck. Again, if you're like me, you're working from home, maybe you're working at the desk, you find yourself maybe hunched over. So it's just important to keep mobilized throughout the day. And we'll just go for 3, 2, and last one. Great stuff. We're going to move down the body a little bit then, again, to a part of the body that for yourselves may become stiff during the day, which is the shoulders. So what we're going to do, we're going to lift the shoulders just up under the ear and just roll them back. Okay, so up, hold for a second, and just roll the shoulders back. Up, nice, slow, controlled movements. I'm just going to go for 2 more, up and around, and hopefully you're starting to feel a little bit looser now than when we began. We're going to move on now to the chest. Again, the chest can get quite tight as well if we're rounded, if we're sitting at the desk or sitting at the computer. So what I'm going to ask you to do, and there's a mantra to this one, we're going to hold our hands out and we're going to say, let's keep moving. Okay, Roger talked about at the start how important it was to keep moving as we age. So let's keep moving. That's it, just bringing the arms back. Let's keep moving. And last one, let's keep moving. Great stuff. The next one now, I'm going to go to the chair. You can do this standing as well. So this one, if you're in the chair, you're just going to sit towards the front of the chair. You're going to have your hands down either side of your legs, and you're going to reach down and you're going to say, where's my fibre? So you drop your fibre on the ground. Where's my fibre? There was that song years ago, Where's My Jumper? So we've created that now. We're going to call it Where's My Fibre? So just reach it down. The last one off the right and the last one off the left. And again, if you're seated, we're going to move on to the legs now. We're just going to lift that leg up over the sleeping dog, lifting over, and the same off the other side. And again, you can do that from a standing position, maybe with a bit of a support. Just lift the leg over, open out the hip, and lift it back. The opposite leg, over, and back. And final one now off the right side. Lift it back in, over the sleeping dog, and thankfully we haven't wakened them. And our final one now, if you're seated, you're going to start off, you're going to cross your hands just across the front of your chest. You're going to stand up and reach up into the air. If you're already standing, you're going to go up your tippy toes and reach up into the air. Okay? So reach it up nice and high, good stretch of the body. Up on the tippy toes again, slowly back down, and last time, all the way up and all the way down. Get down the arms and the legs, a little shake out. That was roughly about 90 seconds, folks, so well done. Again, little bouts of movement throughout the day is better than maybe doing a full blast later on in the day. So try and incorporate movement as much as we can for ourselves and for the older people that we work with as well. So over to you, Roger.
Thank you very much, Paul. I got moving. Hopefully everybody else got a chance to move during that. So on this stage now, we're moving over to Dr. Conor Cunningham. He was the researcher on the Gallup Project, and Conor's going to give an overview of the program.
Good morning everyone, and thank you for joining us. This presentation will review the Generating Active Lives in Older People, or Gallup Research Project. And this project had a number of aims and objectives, but the key aim was to develop our understanding of the role of healthcare professionals in promoting physical activity to older adults. Now, the Gallup Project also looked at the policy context for promoting physical activity to older adults in the health service, and sought to develop our understanding of the benefits of physical activity for older adults' health. It also sought to develop our understanding of healthcare professionals' knowledge, their decision-making and routine practice in promoting physical activity to older adults in Ireland and Northern Ireland. Later in the presentation, I'll discuss why we focused on physical activity promotion in the health services, and I'll discuss the methods we use to meet these aims. But it is important first to set the presentation in context by providing a brief background to physical activity for older adults and provide an Island of Ireland perspective. Now, we know that at a local, national, European and global level our populations are getting older. We also know that typically levels of physical activity decline with age. Data from the longitudinal cohort studies in Northern Ireland, the Nicholas study, and in Ireland, the Tilda study, has shown us that this pattern of decline in levels of physical activity with age is evident on the island of Ireland. What's concerning is that from the same cohort data, we know that many older adults weren't physically active enough to meet guidelines for physical activity and attain many of the physical and mental health benefits which come from being active. Now, when we build a picture from this and other research that has been conducted in this field, we know that for many older adults, aging is met not only with a decline in levels of physical activity, but also from a loss of functional independence, premature morbidity, and a decline in quality of life. So the first step in the Gallup Project was to broadly review the available and most recent evidence on older adults' participation in physical activity on the island of Ireland, and conduct a review of the most recent evidence for the benefits of physical activity for older adults' health, whilst also examining the policy context for promoting physical activity to older adults, but with a particular emphasis on the health sector and health systems on the island of Ireland. So throughout 2019, IPH with partners in Ulster University conducted a systematic review of all published literature reviews related to physical activity and health outcomes in older adults. And since the publication of this article, this has become a widely referenced and cited source of review level data on physical activity's role in the reduction of cardiovascular risk and mortality, reduction in cancer risk and mortality, specifically breast and prostate cancer, outcomes related to functional status, including a reduction in the incidence of fractures and improvements in basic activities of daily living disability, in healthy aging and improved quality of life for those older adults who met or exceeded guidelines for physical activity compared to their inactive peers. Now, this review also examined physical activity's role in mental health outcomes, reporting a reduction in the risk of cognitive decline, Alzheimer's disease, and dementia, among other mental health outcomes. Again, for those older adults who met or exceeded guidelines for physical activity compared to their inactive peers. The most important take-home messages from this research for researchers, practitioners and policymakers was not only the numerous and concurrent benefits attained for older adults from being physically active, but also that the greatest benefits for health are seen in those older adults who transition from being inactive to taking part in some physical activity, and also that any physical activity is better than none. And this is a message that is strongly supported by the recent publication of guidelines for physical activity in the UK in 2019 and from the World Health Organization in 2020. In addition, and important for those older adults who were active, evidence suggests an increased benefit for health can come from increased volume and intensity of physical activity that they participate in. So the Gallup Project highlighted that the evidence base is well established for the benefits of physical activity to older adults' health. And increasing population levels of physical activity is a public health imperative. But physical inactivity is a complex public health problem with multiple interacting influences. And recent research and policy development at both a European and global level in this area has highlighted that effective action to reduce current trends in inactivity across the life course requires a systems-based approach with action across different sectors. So an important next step in the Gallup project was to review policy for physical activity promotion on the island of Ireland, with a particular emphasis on identifying and developing our understanding of policies aimed at promoting physical activity in the health services, and more specifically exploring the implication of these policies for promoting physical activity to older adults on the island of Ireland. Our overview of guidelines, trends, policies and frameworks conducted in 2018-2019 highlighted that physical inactivity continues to be one of the most important public health challenges facing older adults on the island of Ireland, and that now more than ever it is critical that older adults are given opportunities and are supported to access and participate in a more active lifestyle. Healthcare policies that were reviewed on the island of Ireland to promote physical activity recognise that healthcare delivery has to increase its focus on improving health and well-being through prevention rather than focusing on treatment. There was also a broad recognition that this requires a significant cultural shift in service provision, but also that this has the potential to deliver substantial value for service users present and future. The review of policies and frameworks also highlighted that there is a growing body of research on the promotion of physical activity in the health services, which identifies that the health sector and healthcare professionals, as part of this broader systems-based approach to physical activity behaviour change, can play a key role in promoting physical activity by implementing systems for patient assessment and counselling, and by strengthening the provision of and access to opportunities and programmes that enable older adults to increase their levels of physical activity. Healthcare professionals play a central role in the promotion of a variety of health behaviours and are ideally positioned to promote physical activity. Evidence suggests that they can positively impact patient behaviour by routinely assessing physical activity levels and by using brief practical interventions, such as providing advice and counselling on how to initiate and maintain healthy behaviours, with links to community-based support for behaviour change. Now, these are key actions in promoting health-enhancing physical activity to reduce the incidence of chronic disease and to manage a range of chronic conditions and weight maintenance. Indeed, when we look back again at the recent healthcare policy developments on the island of Ireland, they recognise that preventing and reducing chronic disease across the life course by addressing inactivity requires a cultural shift on improving health and well-being through strategies that focus on health promotion and disease prevention. So, having completed an evidence review of the benefits of physical activity for older adults' health, and a review of the policy context on the island of Ireland supporting physical activity behaviour change in routine practice, we next want to develop our understanding of healthcare professionals' knowledge, decision making and routine practice across a broad range of health professions in Ireland and Northern Ireland, and that was namely general practice, nursing, occupational therapy and physiotherapy. Before we did this, we established a research project advisory group which had representation from the professional bodies of each of these health professions in Ireland and Northern Ireland. And this group was invaluable in the advice and the direction they provided throughout the next phase of the project, which was to survey practicing healthcare professionals, again from these professional groups, on their approaches to promoting physical activity to older adults. And we did that by evaluating their knowledge of current physical activity guidelines and exploring the factors which may influence their clinical judgments and decision making in promoting physical activity to older adults in routine practice. Now, it's worth noting that COVID came to our shores when we planned to launch this survey, so we also had the opportunity to incorporate elements within the survey to develop our understanding of the pandemic and its implications on physical activity promotion in routine care. And the paper on this aspect of the research project is published and freely available, and I'll next take you through the methods and key findings from this aspect of the Gallup project. It was important from the outset with this survey that we aligned the survey questions to a theoretical framework which enables individual and organisational determinants of health professionals' behaviour to be aligned to areas of potential support and intervention in assessing, discussing and prescribing of physical activity in routine practice. And this is a critical step to inform the development of evidence-based strategies for improving uptake of policy into practice. Now, the survey had three main sections. Section 1 captured demographic and employment data, as well as healthcare professionals' self-reported levels of physical activity, knowledge of physical activity guidelines, and awareness of resources to facilitate knowledge and practice development. Section 2 assessed the theoretical component that we discussed there briefly, and this was the use of the theoretical domains framework, which is essentially a framework of theories of behaviour change that is well established within the scientific literature as a method of identifying influences on behaviour in the implementation of evidence-based recommendations. And again, this was used to identify those domains of healthcare professionals' behaviour in assessment, discussion, and prescription of physical activity in routine practice. Now, healthcare professionals' perceptions of the implications of the COVID-19 pandemic on older adults' levels of physical activity and views on the role of physical activity promotion to older adults in light of the pandemic were also examined. We also included a section in the survey on clinical vignettes, which are case studies or scenarios which reflect typical practice. And these were developed with the Research Project Advisory Group, and this also enabled healthcare professionals to self-report routine practice to physical activity promotion with older adults. The survey was widely piloted prior to going live for a 2-month period from mid-August to mid-October in 2020, during which time it was widely promoted through focused email distribution and widely on social media. We had nearly 600 responses to the survey, but when the data was cleaned, we had a total of 347 who met the inclusion criteria and were included in subsequent analysis. Now you'll see a screenshot of the characteristics of survey participants, but in summary, of these, 86% were female and 3/4 were healthcare professionals practicing in Ireland. Nearly half of all respondents were physiotherapists, and nearly a third reported that they had 26 or more years of practice experience. When asked about their knowledge, understanding, and use of physical activity guidelines, responses varied considerably across professions for those who agreed that they were aware of the content and objectives of national guidelines for physical activity in their jurisdiction, with a third of all respondents agreeing that they were aware of the content and objectives of guidelines for older adults. When asked about the specific components of physical activity guidelines, the minutes of moderate and vigorous physical activity, and days recommended to perform strength, balance, and flexibility activities, 49% of all respondents correctly recalled the number of minutes of moderate intensity, and 27% correctly recalled the number of minutes of vigorous intensity activity recommended to older adults on a weekly basis. 52% correctly recalled the number of days that older adults were recommended to perform strength, balance, and flexibility training. Of all respondents, 24% correctly recalled all 3 specific components of physical activity guidelines for older adults. So broadly, these findings indicate that general knowledge of guidelines for physical activity, and more specifically, guidelines of physical activity in older adults, is an area of potential development needed across all health professions surveyed. Again, responses varied considerably by health profession when asked about their awareness of resources to facilitate their knowledge development and practice of assessment, discussion, prescription of physical activity with patients as part of routine care. You can see here from the chart that the most frequently cited resources included government health department websites and professional body websites, or health profession specific websites such as PhysioTools, or more broadly websites with toolkits and physical activity resources such as Moving Medicine. In relation to assessment of patients' physical activity levels, nearly half reported that they never formally assess whether a patient is active or inactive as part of routine practice. In those that reported that they did assess physical activity, a variety of functional assessment tools, questionnaires, or device-based measures were reported. Now, when asked about discussing physical activity with patients in routine practice, most respondents agreed that it was part of their work as a healthcare professional, with many stating that it was easy to remember to do, even in the face of potential barriers such as when the patient wasn't motivated or when there was little time. However, only a third of all respondents reported that they had received suitable training to initiate conversations with patients about physical activity. And more specifically with older adults, many agreed that it was something that they typically did within their organisation. However, fewer agreed that they had a clear plan of how to initiate discussions about physical activity in routine practice with older adults. In relation to physical activity prescription and signposting, only 12% of all respondents always signposted patients to other physical activity services, such as exercise referral programs or community-based physical activity programs and initiatives. The percentage of those who usually or sometimes referred patients to other physical activity services again varied across professions. Most respondents agreed that assessing, discussing, and prescribing physical activity with an older adult as part of routine practice would benefit the public health agenda, but fewer agreed that they were supported to use physical activity assessment, discussion, and prescription in everyday practice. These findings related to assessment, discussion, and prescription of physical activity indicate that assessing physical activity in routine practice is an area of potential development needed across all health professions surveyed. More healthcare professionals need suitable training to initiate discussion about physical activity, and healthcare professionals need support to perform these roles, particularly in relation to prescribing or signposting of physical activity to older adults in routine practice. We also asked questions to explore healthcare professionals' understanding of the potential impact of the public health and social restrictions on older adults' levels of physical activity, and their resultant behaviours related to physical activity promotion with older adults in routine practice. Overall, 71% of respondents indicated that they believed that the introduction of public health and social measures to prevent the spread of COVID-19 had reduced older adults' levels of physical activity. And considering this, 82% of all respondents agree that healthcare professionals can play an increased role in promoting physical activity to older adults. Overall, 85% stated that they were either more likely or the same as usual to discuss physical activity with older adults as part of routine practice, considering the COVID-19 pandemic and its implications. In summary then, the key considerations from this component of the research project were that most healthcare professionals surveyed agreed that discussing physical activity is their job. However, the majority had not received suitable training in initiating discussions about physical activity with patients. And this is perhaps demonstrated in the fact that few had a detailed knowledge of the specific components of physical activity guidelines. And this is important because in an additional analysis reported in this paper, having a detailed knowledge and recall of physical activity guidelines specifically for older adults was associated with formal assessment, initiating those discussions, and subsequent referral and signposting to physical activity services as part of routine practice. The theoretical domains which emerged as particularly important for targeting behaviour change in healthcare professionals were knowledge, skills, and behavioural regulation. Supporting healthcare professionals to routinely integrate physical activity in routine practice requires components of knowledge and skill development, particularly considering the COVID-19 pandemic, where the majority reported that they can play an increased role in promoting physical activity, particularly with older adults. Now, it's also worth noting that this survey potentially attracted those healthcare professionals who have an interest in physical activity and physical activity promotion in practice. And so the sample is potentially biased in that regard. But if that's the case, and reflecting on these results, that further strengthens the argument for developing supports and resources so that all healthcare professionals feel supported to promote physical activity with their patients. The next and final phase of the research component of the Gallup Project was to further develop our understanding of the themes and concepts which emerged from the survey, and to explore other areas in more detail with healthcare professionals. We again recruited practicing healthcare professionals from the same professional groupings, whilst also aiming to recruit across different settings and sectors. Now, you'll be able to see the breakdown of those who participated in the table, but we believe that this approach would give us a detailed picture of healthcare professionals' views on knowledge development and applying physical activity to routine practice, but more importantly, the supports that healthcare professionals feel that they need to effectively integrate physical activity in routine care, and again that was particularly with older adults. Now, the interviews took place during the pandemic, so we were particularly pleased with the response and the fact that 63 participants across healthcare professions, settings and sectors took the time to provide their opinions. And the paper on this aspect of the project has been submitted for review and should be in press soon. Next, I'll take you through the method and key findings. Interviews typically lasted 30 to 40 minutes and were guided by a pre-piloted interview schedule, and they were conducted over Zoom. Now, the schedule was used to explore the key themes from the survey, to develop our understanding of the supports at an individual, structural, or organisational level that healthcare professionals need to effectively promote physical activity. And again, that was through assessment, discussion, and prescription of physical activity in routine practice. The schedule was also used to enhance our understanding of knowledge. How is knowledge developed and implemented in practice? And to enlighten decision making, what barriers and facilitators and models of good practice are evident in relation to physical activity promotion as part of routine care in Ireland and Northern Ireland. Healthcare professionals' responses were digitally recorded, anonymised and transcribed. A total of 63 individuals participated in interviews, at which point no new themes emerged. Participants included 10 general practitioners, 19 occupational therapists, 24 physiotherapists, and 10 nurses from the island of Ireland. The data from interviews were analysed using in vivo software, and it was first analysed by coding instances within the transcripts, and these were mapped onto the relevant theoretical domains framework domains that were used in the survey using a thematic approach. Now, this first developed the broad domains related to the application and integration of physical activity promotion in routine practice. The data were then further analysed to generate sub-themes within these domains to explain these areas, essentially using healthcare professionals' views and experiences. Now, the diagram you can see on this slide demonstrates what this process of analysis looks like. And you'll see that the node or theme of knowledge was expanded from the data to include sub-themes. And as I said, these were generated by healthcare professionals' views and experiences to include sources of knowledge development, models of consultation, knowledge of the benefits of physical activity for health, training development, professional development, and undergraduate training. From the analysis, it was clear that there was a broad recognition amongst healthcare professionals of the benefits of physical activity for patients' health, and that was across a range of both physical and mental health conditions that present in routine practice. Participants reported a wide range of sources to support their knowledge development, such as online resources, conferences, seminars and webinars, professional networks and special interest groups. Many healthcare professionals acknowledged that their fundamental awareness of the role of physical activity and its role in prevention and treatment of disease did not come from their undergraduate or initial education and training. And more specifically, there's a need for continuing professional development in relation to promoting physical activity for older adults' health. Again, knowledge and use of physical activity guidelines vary considerably amongst healthcare professionals. Many healthcare professionals acknowledge that being physically active was part of their social identity, some citing that they were keen to be seen to be physically active, and that their perceived position of social influence and responsibility can be utilised to positively motivate patients to change behaviour. Multidisciplinary team working was highlighted as invaluable as an organisational support for physical activity promotion. Furthermore, a culture of promoting physical activity at a departmental or organisational level was important to ensuring the effective application of physical activity promotion in routine practice. Several healthcare professionals highlighted that there was still scope for improvement in addressing physical activity in comparison to other health promotion areas addressed in routine practice. In relation to integrating physical activity in routine practice, the assessment of physical activity was informal across all healthcare professions, with several healthcare professionals identifying the adoption of a more formal assessment as an area for potential continuing professional development. Assessing a patient's functional status was much more structured. When discussing physical activity with patients, several healthcare professionals reported that they were guided by how the consultation unfolded and the rapport that was developed with the patient during the consultation as to whether to discuss physical activity. A lack of time to routinely integrate physical activity in patient consultations, lengthy patient waiting lists, and large caseloads were commonly cited barriers. Limited resources were also identified as barriers which impact the capacity of healthcare professionals to effectively integrate physical activity promotion in routine care. There was also a general lack of clarity and consistency between the use of the terms and meaning of physical activity and exercise in practice, with the terms used interchangeably, and several healthcare professionals identified the need to differentiate between the terms exercise and physical activity with patients, as exercise has potential negative connotations for some older adults. One participant highlighted a professional body scheme from the Chartered Society of Physiotherapy, the Hate Exercise, Love Activity programme, which addresses this, whilst another participant identified the use of clinical linguistic training as an area of potential continuing professional development for all healthcare professionals in this regard. In relation to referral and signposting of patients, as most interviews took place during the COVID-19 pandemic, participants were asked to reflect on typical practice prior to the pandemic and reflect on their experiences of prescribing physical activity as part of routine practice. The MDT structure was highlighted as important for promoting community practice linkage. In addition to this, the importance of having a community navigator either within the structure of an MDT or as part of the wider integrated care partnership or embedded in the community was highlighted in several interviews as important for the integration of physical activity in routine care. One healthcare professional highlighted a networking opportunity as a potential mechanism to facilitate knowledge translation of service provision at a community level. It was highlighted frequently that a well-developed and resourced program can have significant benefits for increasing participation in older adults. But it was also clear that the range and availability of community-based resources varied considerably between practices and communities, from state-of-the-art facilities to little or no access to onward referral. A key component in this research was to give voice to healthcare professionals' own opinions on the supports that they need to effectively integrate physical activity promotion in routine care. And in this regard, they identified a number of areas. Many healthcare professionals in this study highlighted continuing education and skill development as essential to raise their confidence and competence to undertake assessment and provide brief advice or counselling on physical activity in routine practice. Many accredited their working knowledge of physical activity in prevention and treatment to continuing professional development rather than to their undergraduate or initial education and training. Healthcare professionals also identified the need to increase service provision of training and practice development to support this knowledge development through what they described as focused training, promoting available resources, education on behaviour change techniques, and displaying infographics. And these were identified as potential areas for service development to promote healthcare professionals' knowledge of the role of physical activity in routine practice. Several participants identified that greater investment in prevention was required to adequately fund training and resources to support healthcare professionals to effectively integrate physical activity promotion in routine practice, and to smooth the transition from a treatment model of healthcare to prevention. But that also to support this, campaigns are required to raise both healthcare professionals and the general public's awareness of the benefits of physical activity through what they described as supportive public health campaigns. In addition, they identified health and well-being programs for healthcare professionals as an area of potential service development to foster knowledge and the subsequent belief of the benefits of physical activity that may transition into routine practice. Integrated models of practice were identified as helping to establish a culture where every healthcare professional works effectively together to share knowledge and apply physical activity to a patient's care. And changing the culture of practice is something that we've heard on a number of occasions in this presentation. Motivational interview training, in the emergent theme of models of consultation, which we looked at earlier, was highlighted as a potential area for practice development to support healthcare professionals to anticipate barriers such as patient motivation and discuss patient-centered solutions to effectively address these barriers. Again, multidisciplinary team working also facilitated patient referral using the available healthcare professional resource within a practice, and healthcare professionals who worked in a setting that had access to a social prescriber also identified this as an extremely valuable resource, highlighting that this individual or service was key to the development and maintenance of effective community practice linkage. And this was also identified through community resource mapping, a framework for the integration and maintenance of social prescribing within the health service in Ireland has just recently been published. In conclusion, the different components of the Gallup Research Project met their aim of developing our understanding of the role of healthcare professionals in promoting physical activity, particularly on the island of Ireland. And throughout the process, we established that the evidence base for physical activity's role in older adults' health is well documented. Policy development supports the promotion of physical activity in the health services as part of a wider, systems-based approach to changing population health. Health professionals identify promotion of physical activity as part of their role, and they have a key role as trusted and influential members of wider society in this process. But there are also clearly identified supports that they need to enable them to do their job effectively. And above all of this is an umbrella of cultural change in the health services. And it is this shift that will be key to meeting the broader goal of improving population health and well-being through the implementation of strategies that focus on prevention rather than on treatment. Can I take this opportunity to thank you for listening and to give special thanks to the members of the Research Project Advisory Group for their support with the project, particularly given the challenges that COVID has presented. And there are a number of themes and questions which have emerged from this research, and I'll hand you back now to Roger, who will discuss these with the panel.
Thanks to Conor for a very clear presentation and a great overview of the research programme. Just to let everybody know that the PowerPoint will be available after today and will be on the IPH website. And again, the lay summary of the programme will also be available. There's an opportunity for people to submit questions if they want in the Q&A. But before we go straight to the panel discussion, we're going to have Paul again, who's going to put us through our numbers about keeping physically active. So Paul, you're very welcome again. And I'll hand over to you now.
Thanks a million, Roger, and thanks to Conor for a very insightful presentation there. Certainly a lot of food for thought. So welcome back, folks. I hope that I haven't scared too many people off now after our first little mobilising session. So we're going to move it on now to an energising session. So that means we're just going to do bigger movements, and we're going to target the hearts, we're going to target the lungs as well. So we're actually going to do what may be, I'm not 100% sure, but may be a world first. It's the first ever dry land triathlon. So all the events, usually triathlons, are swimming, they're cycling, and they're running as well, where you can jog them. So we're going to do the first one. We're going to do our swimming on dry land. Unfortunately, my pool at the back is out of action, so we're just going to do it from the chair. So we're going to start off, folks, again, just on your chair, or even for the swimming part here this morning. You can do it in a standing position as well. So we're just going to start off now, just with a nice front stroke. So just one hand at a time, just lifting the arm up off the right and off the left. And we have the racing now. We're all racing each other this morning. With the racing music in the background there, and I'm not sure if you can hear it. Just one at a time, and then we're going to go in reverse. So we're going to go for a backstroke then. Again, just lifting the arms back, one at a time, off the left, off the right, great stuff. And then finally, we're going to go into a bigger movement now, into our breaststroke. So we're bringing the hips into it as well. We're just leaning forward, spreading the arms out as we lean forward and pulling them back either side. Great stuff. I can see the coastline now, it's coming into view there. And once we're done with this, we're going to jump on our bike. Just 3 more strokes, great stuff. Last 2. And final one. I'll ask everyone now, you can go onto your chair, if you're not already on your chair. And we're going to go on to our bike. So we're going to sit towards, maybe from halfway to the front of the chair. We're going to lean back onto the chair with our feet out in front. And we're going to jump on our bike. Hands on the handlebars now. We don't want anybody falling off this morning. Just keeping the feet moving as much as you can. If you need to take a little break, you can do that as well. Jump on the bike, grab a drink of water, 3, 2, and 1. Up all the feet then. If you're comfortable, you can march out on the chair. If not, and we're just going to march it on the spot. Okay, a bit of a slow jog. Get my hands moving by the side. Lifting the knees up as high as we can. That's it, getting the heart rate up. And if you want, you can bring it into a little jog in the squats as well if you wish. The finishing lines coming in sight. We're nearly there. Last 5, 4, 3, 2, and hands up in the air for the big photo finish. Well done, folks. I don't know about you, but I actually forgot to take off my wetsuit there, Roger, so I might have to go back again to the start.
Okay.
Might have looked a bit strange. So thanks a million, Roger, for having me. Thanks, folks, for tuning in. And again, that was just 90 seconds, just like the mobilizer, and just trying to incorporate them as much as we can throughout the day, keep it as active as we can for as long as we can. Thanks, Roger.
Thank you very much, Paul. That was really great. That's the best swimming that I've done in years. So thank you very much. That's really, really good. Okay, before we move to the panel, and remember, you can submit your questions. We're just going to have 2 more quick polls. Adam, can you put the next poll up on the screen, please? Okay, so this is about your own level of physical activity. Did it increase, decrease, or did it stay the same? So during the COVID-19 public health social measures, did your own level of physical activity increase, decrease, or did it stay the same? Okay. Okay, Adam, so do you want to share the results? So we have 50% indicated that it increased, about 30% decreased, and about 1 in 5 stayed the same. So that's really positive. Okay, we'll go to the next poll. Okay. And so the easing of the lockdown restrictions in recent months, has it encouraged you to exercise more, yes or no? This is your chance to share with the rest of the people. Okay, Adam, do you want to share the results? Oh, sorry, Adam, not just so. Yes, about 6 out of 10, and no, just over 4 out of 10. So, okay, that's really useful. Maybe we can think about that as well on the panel. So now we're going to move to the panel discussion. So if the panelists can just turn on their screens. So I'm delighted. We've got a great panelist. We've got Chris Leggett, a GP based in Northern Ireland. We've got Vanda Cummins, who's a physiotherapist based in the Health Service Executive. We've got John Brennan, an occupational therapist, and Deirdre Lang, Director of Nursing on the National Clinical Programme for Older People. So you're very welcome to be part of the panel discussion. Before we get into the questions, do any of you have any reflections on what you've heard this morning in the presentation? Any initial thoughts? Does anybody want to share anything? And I'll start on the top because Deirdre, you're on the top screen, so apologies. Any initial thoughts or reactions? We've got a series of questions to go through here, but just any initial thoughts.
Yeah, I think that one of the things that stuck out for me, Roger, was in relationship to healthcare staff knowing they need to promote activity and not knowing how to do that. So there's something really powerful in that enabling, and also the definition of what we talk about in movement and how people find it quite intimidating to use the word exercise when we might not be actually talking about that. There's so many different ways people move.
That's brilliant, and I think we're going to touch on both those points, and maybe later on about the negative perception, and maybe that, you know, dates back to school days if you didn't like PE or maybe you did. Vanda, John, so we'll go to Vanda. Any initial, before we get into the questions, any initial observations or comments? And again, Vanda, you were on the original Gallup Research Project Advisory Group, so thanks again. Any initial comments or observations?
Yeah, I would agree with Deirdre there. I mean, I think in the health service where I work, I think we're very good at providing sick care, but we're not necessarily good at providing health care. And I do feel that's what we should be fundamentally looking at. And I think we do need a big culture shift, and we do need to look at the complete workforce within our healthcare. We should be role models, and from the top down and the bottom up, we should all be promoting good health and activity, and it should be encouraged. It needs to be incentivized. We should be rewarded for doing it. And I suppose I'm a physiotherapist, and it's an area I'm interested in, but there's no one precious about this. I mean, we all should be leaders. We should all be champions. It's everybody's business. We're all in the business of moving, as Deirdre said. We all need to move. Not all of us want to exercise in the formal, structured way that we think about exercise, but we all want to move, and we all want to be independent and do the things we enjoy and have fun with. So we really need that, to use the right language and the enjoyment and the fun, and just really wake up to this is really important for us as much as it is for our clients and our patients and the whole community as a society. But we're all, it's everybody's business.
Yeah, thank you, Vanda. That's really, and I think that's what we'll probably touch on more in the panel, is about that. How do we change the language and make it everybody that should be interested? Okay, and so John, do you have an initial observation on what you've heard? And again, you were involved in assisting us on the Gallup project.
There's, Roger, I do indeed. The one that really jumps out at me is the fact that so many people, so many of the health professionals that responded to this study see their role in promoting and engaging others in physical activity. But yet then you have that gap between those people who see it as their role, or we all see it as a role, but the gap then in actually doing it and actually doing an assessment and doing the encouragement and everything that goes with it. I think the other really important bit to take out of all of that is, in terms of our learning from it, it's not about completing very in-depth assessments or very in-depth exercise programs or whatever. The research is fairly strong in that if we look at simply increasing our positive risk-taking a little bit with our patients, encouraging the patients and linking them in with the services that are already there and the facilities that are already there, we've gone a long way towards our work. So we need to make sure that in order to bridge the gap from those people who see it as their responsibility, don't see it as a massive or a huge or onus or responsibility either. Let's look at the research, look at what works in terms of promotion, in terms of behavioural change. But it's good. John
and Chris, any initial thoughts or observations from your UCIT?
Thanks very much, Roger. Very interesting and relevant research. I thought it was very interesting that your last poll showed that most of us have increased our activity over the lockdown. As a GP, my concern would be for the frail elderly. And I think most of them, that hasn't happened. I think they were more afraid of going out. The other thing is, it was mentioned about social prescribing, and in our own practice, we have been piloting strength and balance programs, which were very successful, and they have all stopped. And I think the most immediate need for the reintroduction of policy is with the frail patients, the reintroduction of strength and balance programs and exercise aimed at the elderly. I think I'm seeing lots of evidence of deconditioning, increased falls, and I think that should be a priority. Not to say that it isn't good to get younger people involved in exercise, but I think most of the public actually increased their exercise during the lockdown, but frail elderly patients, it has decreased, and they have really deconditioned, and I think they need to be tackled quickly.
Okay, so thanks very much, Chris. When I seen the results of the poll, what I thought was we have a very physically active group who have attended today. That's because it's a topic of physical activity. So we're people here that's interested in. I think your observations from your practice would reflect, I imagine, at a population level. So let's start off with some questions coming in. So from your perspective of your profession, how can we advance education, training, and access to resources for physical activity promotion? Because that's a theme that was coming through about education and training and resources. What's your thought on how we can advance that? What's needed and what will work? And I suppose the other part is what won't work. So that's all, we all get a lot of information. We all do different courses. So what's needed? So Deirdre, great, your hands up. So thank you.
So I don't want to speak about this from nursing, because anything to do for me with older people has to be interprofessional. So I think that's where we start. We start with interprofessional education, where people actually understand the reason why activity is important. I mean, you can go around saying 150 minutes of exercise to people till the cows come home. But if they realize in an acute hospital setting, for example, that I'm at risk of falling, so I need to move, rather than I'm at risk of falling, I better make sure that they better make sure I sit down. And that leads to a reduction in muscle mass, and then that enhances my risk of falling. So it's about peeling back that whole sense of layers about the why, the 5 whys. And it needs to be not just the physio's job. It needs to be everybody's job. So if the porter is taking me to X-ray, that they check in, and am I okay to move and to walk with them, depending on the distance, obviously. But stop with the wheelchairs, stop with the commodes to the bathroom, and get people up, dressed and moving.
Very good, very clear, very clear. So Vanda, do you have a comment about how can we advance education and training and access to resources in this area?
Yeah,
in terms of, go ahead.
Sorry, yeah, no, I think training is very important, and I think both structured training, but equally unstructured within the workplace, encouraging champions right throughout the workplace. Like they go hand in hand. We don't just want to sit listening to lectures. We need to feel it, we need to understand it, we need to live it. And that's really, really important. So it's very applied training into our workforce. And, okay, we've gone on this training, what can we do immediately in our workforce? Taking breaks, people are burnt out, we're rushed, we're not, there's not a good culture here of looking after ourselves. And I suppose I speak about that because I think if we don't look after ourselves, how are we going to look after our patients? And, so it's both are very, very important. And I think if we're good role models, then we're going to be able to help our patients more. But, I think the key thing, and Deirdre touched on it there, is when we look at what they are, we don't want to scare them with their numbers of you have to do this. It's like, where are you at? What matters to you? What do you need to be able to do? What's meaningful to you? What's purposeful? So I start where you're at. And I suppose that's where I go and visit. Chris mentioned there about the frailer older people. It is shocking what we're seeing out there. People are so deconditioned, they're still afraid to go out. It's a huge problem. We need to understand where they're at. That's where we would maybe be able to do measurements with them, just gentle ones, and give them little goals, but they're all around things that are important to them. So I think, yeah, the training is including about language and how do we change behavior? How do we get that ripple effect? I love that one small change and the ripple effect with that. And just start with the simple things. This is not complicated. We're all in the business of moving. Keep it simple and do it well, and what's meaningful and what matters to us and our the people we help.
I remember Deirdre last year giving a brilliant example about for an older person standing up in between the TV programs during the advertisement breaks, just standing up. It was very simple, and that really struck with me because that was just easy to remember.
Yeah.
And
sit less, move more. I mean, there's small messages. Motion is lotion, all these things, just really simple things. And we start from the person who's very sedentary, sitting a huge amount of the day, to maybe getting up, going to the toilet, maybe just doing a few more little stands, and then maybe more purposeful activities around the house. So you can build it slowly. And the ultimate thing is a structured exercise program, but most people we see aren't there. And so we have to go back to where they're at and encourage them where they're at. And there should be no failure in this. Absolutely no failure. Everybody, whatever they do the best they can, and they should be nurtured and encouraged, and it should be really fun and enjoyable and meaningful. And yeah, just, you know, people say to me, oh, I feel bad, I didn't do my exercises. You know, why are we doing that to people? You know, we shouldn't make them feel bad because they're not doing something. We're humans. We take the easy option, I think, in life. And that's another thing, the culture, we need to make movement easy. We need to make it the easy option. We need the environments to be easier.
Okay, so you have a couple of points, and I will get back to those. Chris, any thought about education and training? Because what came through was that you know, not everyone felt they had the appropriate training to provide the support. So how can we provide that training support? Because we've got a panel of people who know the minutes, who know what to do, but how can we support more people?
Yeah, Roger, I think that's a good point. Health professionals have always given health promotion, and as a GP, I'm tending to do it in the context of a consultation. And traditionally, we probably focused more on smoking and alcohol for good reasons. But now I heard the phrase recently, sitting is the new smoking. And I find that a lot of my patients don't smoke and they don't drink excessively, but they're not very active. And I think that obviously professionals need a bit of knowledge, but they also need information on how to give information. I think Vanda's point there about not overloading people, you have to tailor the information to the person you're dealing with. So, and you have to be careful about your use of language, as has been mentioned with Joe Turney in the communication there. Exercise for some people means going to the gym and not a duty. Whether it should be fun, we should be encouraging people to be active. We should be encouraging them to walk and do more. But you have to tailor the advice for that particular person. And obviously, younger people will benefit more from more vigorous activity, and it's all relative. In terms of the training, I think it has to happen at undergraduate level, at postgraduate level, and at multidisciplinary meeting or multidisciplinary team level, so that we're all giving a consistent message.
Okay, that's great. And John, it's always the difficult one because you've been left to the last.
That's all right. Look at, in terms of training and education, there's a couple of things that jump out to me. The first one will be in terms of the importance of moving from a bottom-up approach to a top-down approach in how we train our therapists and nurses and doctors. And what I mean by that is by listening very, very carefully to what the patient or the person is saying to you and taking action based on that. I go back to the old Mickey Hart adage, you know, we've two ears and one mouth, and there's a reason for that. And in terms of exercise prescription, for the want of a better word, that principle applies. So when somebody comes and says, I have a pain in my knee, and then if you ask the very simple question, well, if you didn't have the pain in the knee, what would you be doing differently? And invariably someone will say, well, I'd walk in the park, or I'd whatever. And then you can start building towards that using whatever methods are necessary. But you can only get to that approach by listening very, very carefully and discovering where the meaning and the purpose for the patient is. So really, in terms of training, it's about listening more and understanding that we are not the experts in everything. All we are doing is listening and trying to develop a sense of self-efficacy in the patient, so that the person has a sense of, okay, do you know what? I can stand up between TV programs, or I can go and meet Mary at the gate, or I can whatever. But to do that, you need a top-down approach, and we need to move towards positive risk-taking, and we need to build that into our training.
Okay, well, thank you, John. That you've covered a number of different parts. I'm going to go back to Chris rather than go back to Deirdre, just to give her a break. In terms of how do we change the perception of exercise as being negative? So, Chris, do you have any thoughts on that? Deirdre, you're next, and then Vanda, and then John. Yeah, back to you.
I think we have to be careful with our use of language, so that, you know, sometimes if I say exercise, I ask people to do the exercise and they say, well, no, I don't go to the gym, but they do walk. And I think we have to get across the benefits and that they will enjoy. And sometimes it's just they're stuck in a rut. And as I say, you tailor it to the individual person. But I think we have to emphasize that actually doing activity and physical activity should be enjoyable. And for the elderly and frail patients, I talked about going to those strength and mobility classes, strength and balance classes. There was a social aspect. They were getting out of the house, they were improving, it was stimulating. And I think we need to get that message. And of course, what will be active for one person, increasing activity for another will depend on their context. So I think emphasize that they will enjoy it if they do it. And sometimes you do need the help. I mean, we had the social prescribing and we had local walking classes and walking groups. And that isn't a massive expense for the health service. I mean, that was through social prescribing. And I would be keen to get those up and running as quickly as possible because they have been affected by COVID. So various different answers and opportunities.
Okay, thanks, Chris. So Deirdre, how do we make physical activity fun? You know,
yeah. So do you know that ad we saw at Christmas, and there was the older gentleman who wanted to be able to lift his granddaughter up to put the fairy on the Christmas tree, or the angel on the Christmas tree, and there was an ad where he was doing dumbbell lifts. So we had a purpose, and that's what Vanda talks about and what Chris talks about. He started off unable to do that, and he had a purpose, he had a goal. It's what matters to you, as we've all been saying. And in relationship to what Joe has put on the chat there, it's about being out socially, being part of a team, being a part of a group, being part of, you know, women going to meet in a centre that they can have a chat, but they walk there. That kind of, it's about your whole sense of community, your whole sense of purpose, and that it's not, and it builds on what Chris said. What's increased activity for me could be very different to increased activity for you. And my whole focus is about the frail older person and trying to prevent that frailty, or trying to help someone to come out of that frailty to get a little bit fitter. So it might be just from sitting to stand in your chair, to be able to get to the front gate. And it's about every day doing something more than you did yesterday, so that you're not actually failing, you're winning every day.
That's brilliant. And it is, I think that's the idea about the purpose behind it and enjoy that example about the Christmas tree. That's a brilliant way of framing it. Vanda, any thoughts?
Yeah, no, totally. I think we need to put ourselves in the other person's shoes. There is no one size fits all here. We need to the language is very important, excuse me. We need to be setting goals, what's important to them, educate them. You know, we need to be telling them it's okay to possibly feel a bit of huff and puff. That's normal. If their goal is to train and improve and reactivate muscles that maybe haven't been working in a while, maybe they want to build reserves. They're doing very well. They want to stay very well. Maybe they're at a level where they're not able to do a lot, but they want to manage within the framework that they're in. So we need to really educate them, take the fear out of it. You know, if they have pain, reassure them if it's appropriate that it's okay. This will, the stronger you become, that pain will decrease. So there's a lot of work there. And then, you know, messages like, you know, I think strong, steady and straight, they're lovely key words. You know, you want to be strong on your feet, you want to be steady, and you want to be straight. And they're simple things people can do in their homes. There was a message in the chat box about an older person who couldn't afford the gym and it was hard to get there and blah, blah. We don't need gyms. We have our house is our gym. You know, we turn it into, we have everything we need there. We have walls, we have tables, we have chairs, we have banisters on stairs. We have everything we need. We do not need extra equipment. And we can use stuff in the house and we can use our body weight and everything. Simple things. We start where we're at and use kitchen counters and all these kind of things. So you know, we don't need, keep it simple. The basics are there and you work within where you've got. So there was another question about the value of strength and balance and is it effective? The answer is overwhelmingly yes, if it is in the right dosage and you know, the right amount of work and for a long period of time. And this is where it's the duration is very important. Really, if you want to improve your balance and your strength, you could be at it for 6 months. I don't say to people you're on a 5-week or 6-week program. You know, we're on it for life, but we do what we can and we set little targets and goals and we build slowly and we progress slowly, and that's how we improve. And like I think there's been wonderful work going on out there. There's so many organizations working. We need to work better together. We all you know, all the community social groups need to come together and work clearly on this. I just one last thing I say, I think Operation Transformation, there's some people love it, some people don't like it. They think it's bully tactics. Other people love that experience. But I think they have done a lot of good things. And one of the things that came out this year was know your baseline. And, you know, get your waist circumference, test your balance, your strength. So, you know, you can understand where you're at and where you need to start in your own home. And perhaps we need a program that's not quite as intensive as that, but maybe we look at people over the longer period and we take people of all ages and of all abilities, and we start where they're at and we just set their goals and we work with them. And it's not as maybe with Operation Transformation, it's great, but they're very strict on where we bring people. And I'm just suggesting maybe, you know, be kinder to people.
So thanks, Vanda. And again, I think about physical activity, it's about what you're interested in, what you enjoy. You know, is it dancing? Is it gardening? You know, is it shopping? And somebody asked, could they give us more examples? IPH last year produced a fact sheet showing different examples. So we'll get that put up again on the website along with the PowerPoint. Chris, you had your hand up?
Yeah, I thought Vanda made a very good point there about the home being the gym. And during the lockdown, there were lots of Peloton ads so people could competitively cycle in their own home and compare themselves with other people. Maybe we need some sort of home exercise program by Zoom aimed at elderly people, so they could be exercising together, a very simple form, and it would raise awareness of the benefits of that sort of exercise and make it more comfortable. If we can't have the real thing face to face, and of course we maybe need a whole lot of those, we need everything, but that might just be something that would be a bit novel and stimulate a bit of interest. And I could see Vanda leading the group.
Paul, where's Paul gone? Paul is doing amazing work online at the minute. They're broadcasting 2 and 3 times a week, Aging Opportunity. So there's great work. Sale Blur doing stuff. There's really good stuff out there, and we just need to all come together and maybe, you know, improve our language a little bit. And I think technology has a huge role to play, and we need to look at online interactive things and apps and everything. There's, you know, it's exciting time really. We can really work on a lot of projects together now that, you know, join the dots with technology.
Okay, well look, I was just going to, you mentioned Aging Opportunity, Sleep Blue, and in Northern Ireland there was Move with Mary. AGNI had that program again, a specific program focused on older people. John, any comments on that?
Yeah, what immediately comes to mind is I worked in mental health many years ago, and it was a phrase I used often in mental health, and it was action precedes motivation. And it's something that I use with the older, frail patients now, you know, on an almost daily basis, is to take action and to make changes, to make that first step can be very, very difficult. And therefore, you know, in terms to improve the motivation and to improve the engagement with that, I just explain simply that action precedes motivation. Ask you to do it once, then evaluate it. Let me see, how do you feel now that you've done? I bet you feel differently than you did beforehand. You know, there's people here who are into triathlons and swimming, and, you know, but by the time when they put on their togs on a Sunday morning, or get out of bed on a Sunday morning, put on their togs, they're not often all that motivated to do it until they actually get into it and do it. So a lot of the fun is in the doing and getting the person started. If we can get the person started and remove some of the barriers in whatever way possible, be the physical barriers or psychological barriers or societal barriers, people should do pretty well. Okay, well look, thank you. There's a clear message coming. There's a change in terms of healthcare professionals, but a cultural change also in wider society. Vanda, you touched on technology. We've got technology, media. Any comments or thoughts on how that could help? We recognize that older people have barriers often around use of technology. How can technology help older people, but also healthcare professionals in terms of promoting physical activity or undertaking it?
Yeah, no, I'm not an expert on it, so I'm probably not, but I think it has huge potential. I think some older people are definitely struggling with it and they don't like it. I know there's a lot of work in the background going on to make apps that are easier to use and tablets that are easier to use and all of that. So we need to continue to work with that. And I think families have a great role to play with that. I think carers can help as well. I do know of some research in the UK with dementia patients, and they were given these tablets, they were set up, and they had the technology that they could switch on at a certain time. So all the older person needed to do was sit in front of it at 12 o'clock, and it would come on and somebody would talk to them and interact. And it did work. I think we can do it if the willingness is there, and it's not just one group will do it. I think it'll be, again, across a load of sectors, and there's great work going on. I think Alone have done huge work reaching out to older people, and I don't know of all the work, but I know there is a lot of work out there on technology at the moment, and we need to build on that and keep going in that direction. And hopefully as health professionals we can then maybe share and learn from that as well, and network, signpost people, all of that. The potential is huge. Okay,
Deirdre, Chris or John, any comments on technology before we go to our final point?
I think Paul is the one to talk about the impact that age and opportunity have had. There's an awful lot of work being done on telehealth. Can you hear me?
Yeah, we can hear you. Yeah.
So there's a lot of work being done on telehealth, and I think we're only just starting. I think it's somewhat ageist to say that not all older people can use apps. There's a lot of people using them that, because during the lockdown they had no other alternative. So I do think that we do need to adapt them for older people, but I do think that is a wonderful way of being able to help people with exercise and with being connected.
Okay, that's brilliant. Okay, and John.
Sorry, just to add to that as well is, I think it's our responsibility as healthcare professionals to be aware and know of the age and opportunity facilities that are out there, or the Alone facilities that are out there, and encourage people and engage people in using the technology. Likewise, there's my experience is that once people are shown, be they old or young, how to use the technology and how to engage in it, they will. It's not a case of I'm old and therefore I can't.
Okay, and Chris, any comments on that before we go to the last question? Just need to unmute yourself.
I think technology is a tool, and I would agree with Deirdre that there's many elderly patients did learn how to use technology during the lockdown, and we need a multifactorial approach. Technology was great when there was no other alternatives. I think there'd be a novelty thing, so that as well as, it could be a way of involving a lot of people and also teaching people an example of the right sort of exercises to do, and a bit of a nudge and a bit of a facilitator, but we want a whole lot of approaches, because it won't suit absolutely everybody.
Okay, well, that's great. Look, Deirdre, last message to other healthcare professionals and older people. Any final sentence or?
Yeah, so within the Republic of Ireland, we started Get Up, Get Dressed, Get Moving. It's a national campaign. If you're going into hospital, please bring your shoes and your day clothes, because wearing pajamas says you're sick, and wearing clothes means you're getting better and on your way home. It reduces hospital-acquired deconditioning, and you don't have to be in hospital to get up, get dressed, and get moving.
Brilliant, thank you, Vanda. Any final message you want to give?
No, not really. Sorry, I wasn't
okay,
I was reading questions about it.
Okay. Yes, we didn't even get. We've got loads of questions. We've covered the broad themes. And John,
let's not overcomplicate it. Let's encourage people, use our leadership skills and use our knowledge to encourage people to get out and about and do a bit, and take it from there.
Okay, and Chris, any final message?
Sitting is the new smoking. Activity is fun.
Okay, great. Thank you very much. Look, thank you all so much for giving up your time this morning. We had 30 minutes. We've ran over by nearly 15, and we haven't got through all the questions. So you can see the level of interest and energy in this. Thank you so much for your time and contribution and your wisdom this morning. Thanks to everybody for taking part. Thanks to everybody for submitting the questions. The Zoom will be available after this webinar, and the PowerPoint and the publications will be available on our website. It's just now my finalist to thank the panel again for their contributions. Thanks to Conor as the researcher on the project and the Gallup Advisory Group, Thanks again to the Minister. Thanks very much to the comms and IT team. They're working behind the scenes, and thanks to Leah for all the work in the registration and the invites. And finally, thank you all for giving up your morning, and thank you for giving me 15 more minutes of your time than you had originally planned. So everybody have a safe day. And so we've got the message, move more, sit less, stay active, and take care. Thank you very much.
Thanks.